Hi, I'm Mike Dilk and you're listening to the Relax Back UK show, the show that explores all kinds of health topics relevant to you, your family and your friends. Each week I talk to expert guests from a range of backgrounds to inform and entertain you. So please do join the Relax Back UK family and stay tuned.
Hi, and thank you for joining me on the Relax Back UK show this week. Tell me, how are your hormone levels? A lot of things can really affect them.
It's macronutrient being ultra processed, micronutrient deficiency, stress levels. I really do think is a massive impact, especially in today's culture. It's just this rushing round syndrome where people are doing so many different things and it's having this impact on our hormones.
Now, how are your hormones is not an everyday question, I get it. But my guest this week, Dr. Milli can help with hormone imbalances for men and women and address some of the problems that they can cause. So please do stick around for a great show. Thank you.
This show is cool!
Before I introduce Dr. Milli, I just want to thank all of you that voted in the UK Health Radio Awards. Voting's closed now. There were quite a few categories. There was the Health and Wellness series where Dr. Milli was nominated. There was the presenter category where I was nominated. So a big thanks to all of you if you did vote, and even bigger thanks if you voted for me or Dr. Milli. A quick reminder, if you are suffering from a bad back or worried about your posture, you can check out the Back App Chair. It's helped many people who are in pain. Details of that are on my website, relaxbackuk.com. Now, let me introduce you to Dr. Milli Rayazda. Everyone calls her Dr. Milli. She's a hormone expert, and I started off by asking her what her background is and what got her interested in the area of hormones.
Yes, thanks, Mike. Thank you so much for having me on today. It's lovely to be here to chat. So my name's Dr. Milli. I am a GP by background. I've got my own private clinic seeing patients online with chronic health conditions and long-term health conditions, such as hormonal dysfunction, chronic fatigue, and so on. And what led to my interest in hormones was my own personal journey. So I've suffered for many years with dysfunction in my hormones. So when I was younger, I was diagnosed with polycystic ovarian syndrome, and that led to issues with fertility and struggled to get pregnant, but also when I did get pregnant, maintaining that pregnancy. And so I had multiple miscarriages. And then always struggled with my weight, always struggled with weight gain and issues with my weight. And then after my children, I noticed that I started to suffer with a lot more premenstrual syndrome symptoms. So in the 2 weeks before my period, developed symptoms where I struggled, and then had a diagnosis of PMDD, which is premenstrual dysphoric disorder. And when I had that diagnosis, the consultant gynecologist that I saw actually induced a chemical menopause. So they gave me an injection to put me through the menopause to stop me from ovulating, to see how I responded. And obviously the next step in treatment thereafter would be to consider removal of the ovaries and have an operation. And it was at that point when I realised that actually there must be something I can do to manage and control my hormones and what's kind of going on in my body. And I wanted to try and do that through lifestyle and through non-surgical measures and without taking quite a lot of medication. So that started to lead me down this rabbit hole of lifestyle medicine. So I did an extra qualification looking specifically at what we eat, exercise, mental health, toxic substances, relationships, psychology, and how that impacts our health and our hormones. And more recently, I've started to deep dive into functional medicine, which is looking at the systems biology of the body. It's not looking at the symptom that people present with. It's looking at the patient as a whole, like looking at them holistically and looking at why they may be developing their health concerns, what's at the root cause. So it's, instead of looking at, like if we think of a tree, instead of looking at the leaves and the symptoms that people present with and kind of putting a plaster on those, actually looking at the roots and finding out what the root cause of them developing that condition is. So that's where I'm doing a lot of my work at the moment. Right. So yeah, very interesting area. Very long-winded answer to what led me to where I am today.
Yeah, but were you successful in kind of treating yourself, if you like, for the hormone issues without surgery?
So yes, I had the injection to put me through the menopause for a year, and then it was after that I thought to myself, what can I do? How can I empower and educate myself? As a doctor, talk about this very candidly in my book. As a doctor, I'm able to look at people and try and help and fix them. So why can't I fix myself was my thought process. So that
seems perfectly logical.
100%. So I started looking very much at my nutrition, and food is information, food is medicine. What the issue we're seeing at the minute is there's so much ultra processed foods with so many xenoestrogens and estrogen mimickers and toxins, and it's having such a detrimental effect on people's health in many different ways. And something is simple, it sounds simple, but something as simple as changing what you eat and being consistent with that and being coached through that can have a huge impact on the way that people feel. So I very much used food as medicine, looked at my exercise, looked at how much I did, because too much exercise can increase cortisol levels. So that it's with everything, and a word that I always go back to is balance. It's all very much about balance of everything. You shouldn't be doing excess amounts of exercise, too much high intensity exercise. We need to be very mindful of what we're doing to in line and in tune with our hormones to try and balance them. So I started to look at food, exercise, stress levels. A lot of trauma and stress in people's life can really drive cortisol levels high, insulin resistance, which can drive polycystic ovarian syndrome. And it's really kind of understanding what's the driving force and addressing that, instead of just kind of saying, right, you've got polycystic ovarian syndrome, let's put you on a contraceptive pill to control your symptoms. What's driving the symptoms and actually addressing those?
Okay, well, that kind of leads into an area or a question that I wanted to ask, because on the media and various places, you do hear about a lot more about hormone imbalances and these kind of issues becoming more prevalent. So my first thought and kind of is that I want to ask you is, how can this be? Is it because we're all a bit more tuned into this stuff now, or are we eating food that are pumped full of hormones, lots of UPF food, this kind of thing? What's going on? What's causing it?
And I think it's a very good question, Mike. There's so many different reasons and so many different facets and pieces to the puzzle of why it is. So food, yes, is an element. There is so much ultra-processed food, which may contain hormones in the foods and the meat, and lots of toxins. So some of the foods contain xenoestrogens and hormone mimickers and things that we call obesogens, which can cause obesity. Estrogen mimickers, like I've mentioned, that can mimic the activity of estrogen and hold on to the receptors and mimic and not work like estrogen, but stop our normal estrogens from working. So why is yes, nutrition is one of those.
Why is that stuff in food? Is that part of the modern processing of food? Or so
if we look at, say, meat, for example, some companies will utilize hormones and antibiotics to increase output and produce. So it can be a technique used, hormones can stimulate growth. So they can use that. But also the way that our food is now, that our farming is very different to the way it used to be. So we're very deficient in a lot of minerals and micronutrients that are essential for our hormones to be produced. Magnesium, for example, so many minerals that are within the soil that should be in the soil aren't. And magnesium it's a hormone. It's a nutrient. It's a micronutrient and a mineral that's required for so many different bodily functions, including hormone production, detox of hormones, and so it's a culmination of multiple different things. So it's macronutrient being ultra processed, micronutrient deficiency, stress levels. I really do think is a massive impact, especially in today's culture. It's just this rushing round syndrome where people are doing so many different things, and it's having this impact on our hormones. And especially if women in the perimenopause phase and the menopause phase, they may have younger children, elderly parents. They're at the peak of their career, and it's this perfect storm where they're unable to kind of cope with that burden and demand, and it's that allostatic load where people really are struggling. So there's so many different reasons why people are having all these hormonal imbalances. It's not just one thing, and I think, especially with the world of social media, people are craving answers and want some help, because it can be very difficult to access NHS GPs at the point of contact because of the demand on the NHS at present. So people are turning to social media for help and advice, and there's so much misinformation out there. And I suppose it's knowing that everyone's individual. So we're all genetically individual. You and I look different. I look different to my brother. We're all so different genetically. But then our epigenetics, which is our lifestyle and what's going on in our life, can impact how our genetics express themselves. So we're all so different in how and that's why there's so many people with different conditions and symptoms and health concerns and different medical diagnoses, because we're all so different in how we express everything. And I think it's all because fundamentally, the way we're wired and genetically built, but then how our lifestyle interacts with that can impact how we express that and how that presents in symptoms.
No, actually, one thing that you mentioned there, you spoke about social media and people getting ideas from social media, almost getting medical help, certainly about hormones and all kinds of different things. In social media, people seem to want immediate help and results. Take this pill, which I'm selling you, and you'll be fine. And I must admit, this is going off topic slightly now, but I see that sort of thing in social media, and it alarms me greatly. I'm quite sure you see the same sort of thing within the realm of hormones, but many other medical things as well.
Yeah, very much so. I mean, I think even as doctors, we all have a different viewpoint on how we see things. I very much like to look at everyone individual and as a whole. And I think everyone's worthy of that. I don't think a comment on social media. So when people ask me a lot of questions, it's very, within our remit, we're not allowed to give individualized medical advice on social media. I know people want quick fixes. And also being very mindful of the fact that there are people who can't afford to pay privately to see someone. So people do want answers then and there. But really, we need to actually look at them as a whole and actually see what's best for them. And that can't be done with a simple question on social media and a quick answer, because a supplement or a medication might not work for one person and it might work for another, and there's reasons for that. And again, like I've mentioned, when I see people in clinic, it's very much looking at them as a whole and coming up with an individual care plan that's specific for them, because that's what's going to work. And actually following that through and tweaking and tailoring things that's personalized for them, because that's the way that modern medicine is going these days. There's a lot of demand for people not just wanting treatment of their conditions and prevention. Prevention's very much in what people are looking at, because they're looking at the lifespan. They're wanting to increase their lifespan. They want longevity. So how can we prevent problems from coming up in the future? If people have got, let's say, type 2 diabetes and they're wanting to come off the medications, what do they need to do that? I see so many different conditions. But if we look at what people present with, it might be tiredness, weight gain, lack of sex drive, poor motivation, low mood. There's so many different things people have, and that may be related to perimenopause, menopause, PCOS. I see people with chronic pain and vulvodynia and nerve pain and pelvic pain, type 2 diabetes, other metabolic problems which can cause the weight gain and the tiredness. There's so many different conditions, and I suppose what I'm very lucky to be able to do is provide that holistic care to people with so many different symptoms and different conditions, because it's looking at the cause, and the root cause, whether that be inflammation, gut dysfunction. There's so many different things that we need to be looking at. And it might be someone who's been taking antibiotic after antibiotic, and and they've got and they're on tablets to reduce acid in the stomach. So they're never going to be able to absorb the food properly. They're never going to probably be able to absorb the B vitamins. And that's going to have an impact on the hormones. And it's someone who's looking at it from a bigger picture rather than here's your estrogen, here's your progesterone, here's your testosterone.
Sure. All right. With that in mind, let me ask a very sort of, I suppose, on one hand, quite a simple question. Just sort of how many hormones are there and how many different processes in the body do they kind of regulate and drive? That's probably an impossible question, but I'll ask it anyway.
I mean, there's so many, and I think, you know, the few that I mentioned, there's, you know, over 50 that I can even think of. There's so many, and there's so many processes in the body that it's responsible for. People, when they say hormones, usually think of women's health, but, you know, hormones, men need hormones as well, and we won't be able to survive without them. They are chemical messages in the blood that send signals from one place to another, and they're important in metabolism, thyroid health, sex hormone functioning. So hormones aren't just about reproduction and making babies. There's so much more to it than that. There's your stress hormones, there's your satiety, appetite hormones.
When you say stress hormones, is that the classic fight or flight?
Yeah, so I mean, we think of cortisol as the stress hormone, but then there's also neurotransmitters such as noradrenaline and adrenaline as well that we need to think of, and the impact that the you know, how our endocrine system and our nervous system work quite closely together as well. So there's just so many you know, there's ghrelin and leptin, which are related to appetite, and I'm sure you will have seen all the new medications targeting appetite, you know, by addressing ghrelin and leptin and the satiety signals.
Yeah, let me ask you about that, because I know that's been in the media a lot. You know, these skinny jabs, or this, that, and the next thing. What are your views on that? I mean, are they a good idea, worth thinking about, or tell me?
I think again, as I've mentioned previously, it's very much what looking at that individual. With everything, there is no one quick fix and one, you know, quick solution to the problem. It's, you know, if people's behavior is not going to change, even with having those injections, you know, if they're going to still eat ultra processed foods, they're still going to have lots of foods that have got toxins in and xenoestrogens and obesogens, and they're going to continue to be sedentary, which is a health risk in itself. And they're still very chronically stressed with work and home life. They're not really addressing the underlying factors. In a subset of women or men, and especially if weight is such an issue that it's causing health problems, you know, as an intermediate, there are special clinics out there that are looking at utilizing this, and it works. So it's a GLP-1 agonist, and it very much looks at the satiety signals and how we can create that fullness, because we know people, as I've mentioned previously, have genetic SNPs or kind of alterations in the genetic code, which makes them more susceptible to eat more, or may not feel full as quick as they should do compared to other people. And so, yes, it might work for some, it might not work for the other. We are in the infancy, and there's a lot more research to be done. So we don't, in terms, look at the long-term health complications of this. But for me, I'm very much an advocate of how we can utilize lifestyle and tailor it to a person, and look at functional testing if necessary, not always necessary, but looking at what we can actually do to work with the patient, which involves a lot more hard work. I suppose it's more looking at your behavioural change as well. So sometimes people do want that quick fix. They do want a tablet or an injection to fix the problem. And I think within the NHS, with the way we have to practice population-based healthcare, we need to look at the resources in terms of cost and see what we can actually deliver. But actually looking at that behavioural change is key. It's looking at what's sustainable and what that person can do in their lifestyle to change things around. That's very intensive, and that involves support. And, you know, on the NHS, where it's like a very sickness model, you know, it's excellent if you're not well, it's great. You know, you've got A&E, you've got people who be able to assist you, but for prevention and longevity and wellness, it's another matter, really.
So for some of these issues, say if you have a hormone imbalance, which is causing you to be very, tired and lethargic. But then you actually start forcing yourself to do a bit of exercise. It can be like a cyclical thing, such that if you do some exercise, it'll help with the hormones, which will help you feel a bit more energetic. So you might do a bit more exercise. Is that how it works? Or
so I suppose if someone comes to see me with tiredness, I mean, my approach would be, well, why are they feeling tired? So you'd take a full history off someone, find out what the problem is. Obvious things to rule out would be any red flag conditions. Are they bleeding from anywhere? Check the stools, see if there's any particular reason. So you check the blood counts and check they're not anemic, check that they've got the right level of blood cells to carry the oxygen and the energy kind of around the body. But there's so many different reasons. Are they tired because, let's say it's a hormone problem, their cortisol's chronically high from stress, or they're perimenopausal and their estrogen, progesterone, testosterone's low? Is it because there's a lot of inflammation going on? Are their immune systems in overdrive? Have they got a histamine problem, so that's causing their energy to be drained? Is it because they're not able to detoxify all the chemicals in the body? Is the liver not working properly? So there's so many different facets to it. So tiredness, it like you said, can impact them people not wanting to exercise. And then being sedentary, you can put weight on, and then that can have impacts on joint pain, and it's like a vicious circle. But I suppose the question for me would be, why? Is it a thyroid problem? Is it a hormone problem? Are they hypothyroid and they're feeling tired? Or is it that they're not able to convert their energy in the mitochondria? So the powerhouses of the cells create that energy. Is there a dysfunction there? So a lot of people with chronic fatigue syndrome and long COVID. So do you see what I mean? There's so many different reasons for tiredness. And I think that's why the art of working with a healthcare practitioner and a doctor to actually understand what's causing it, and then you can put a plan in place to look at that. Yeah. It's not just the case of, right, you're feeling tired, here's some iron. Or, for me, it'd be, why have they got low iron? What's driving that low iron? Have they got problems in their gut? If they got fungus and candida in the gut, which is utilizing that iron. And so we need to maybe look at the gut health. So it's not just looking at that symptom, it's looking at what is driving that tiredness. Is it a mental health problem? Is it stress which is causing, people can feel tired and wired, they feel exhausted through the day, and then at night time when they're meant to be going to sleep, they feel absolutely wired. Is it a problem at home?
Yeah, so actually that leads nicely into a question that I wanted to ask you specifically about testing, because as a member of the public, I can get a test on all kinds of different things, different foods that I might be intolerant to, and also I think I can get results for all sorts of different hormone deficiencies, and I can do that as an individual. So my thought is, if some of those things could scare the hell out of me. And I could go on and do all sorts of things which might not be very sensible based on that sort of information. So what are your thoughts on these home tests?
Yeah, I mean, I think it's great that there's testing out there to try and help them become very accessible to people. So we're not widening any health inequalities. For me, on the NHS, there is testing available. And the results of those can show what's normal. And I think one thing to note is that what's normal versus what is optimal for someone can be very different. So their thyroid hormone levels might be normal for the lab range, but they're still feeling tired. So we need to treat the person and not the blood test is one thing. And so we do need to look at that. Now, there are tests that we can do privately. You can really decipher what is going on from a history. Typically in medical school, we were always told 90 to 95% of what's going on can be figured out by speaking to the patient and actually chatting with them and getting a full history. There's a cohort of healthcare professionals out there that very much think, you need to test and not guess. Now, my instinct would be, if someone that comes to see me, is take a full history, and you just need to assess what is it they want to do, how far do they want to take things, are they wanting to give some techniques that I suggest to try, and then if things aren't balancing out, do we need to be doing testing at that point? I've got other people and patients that really do want to go the full shebang and get private testing for nutrigenomics, so looking at your genetics in relation to how we interact with our foods around us and how certain nutraceuticals, supplements and foods can hack different pathways. And some people really want to know that. So, for example, I've mentioned about histamine. Some people really struggle in the perimenopause with histamine symptoms. That we know that hormones and histamine and estrogen are linked together, but are people genetically more susceptible to that? And so these tests can show, and therefore people might want to take, certain supplements, so quercetin or other kind of supplements that might help them. And it can be quite transformational for people because they find that it helps. Some tests may show something that they haven't got an enzyme to do a process properly, but they've got no symptoms from that. So I think, like I've mentioned before, it needs to be taken in the whole context of that patient. You can't just look at a blood test and say, oh, you need to do this. You need to actually look and see what that patient is suffering with and what we need to do. And yes, you can go and order lots of tests on the internet and get results. And then you might be putting a plan in place yourself that might not be necessary. So that's why I think it's very important that if you've got somebody who's holistically looking after you and is taking control of, and, coming to see a healthcare practitioner that will decide, right, let's do this and then we'll follow it up. We might need to do this and then we can follow it up. I think it's very important because it can just be, it's the same as social media. You can do lots of things and you might not be navigating the correct process. It's I suppose that's like me, I'm not a mechanic. So if I want to do something to my car when I don't know what I'm doing, I can make quite a mess, really.
Okay, so now, after listening to this, you're still a practicing GP within the NHS, but you also help people as a private doctor with some of these other hormonal type questions, stroke problems, or problems that could be hormonal anyway. And how do you do that? Do you do that online, or do you do that face to face? Or
yeah, so it's online, which is great. So it's accessible to a lot of people nationwide. So I only see patients within the UK, and I only see adults as well. It might change in the future to look at kind of children and children's health, but at the moment it's adults in the UK who have got long-term conditions, whether that be chronic fatigue syndrome, hypothyroidism, perimenopause, menopause, lots of different conditions that people are struggling with. So, vulval pain, vulvodynia, polycystic ovarian syndrome. People might come to see me with fertility issues, looking at, what they can do to prevent future miscarriages, to look at how to improve their longevity and health. So there's so many different things. And I think it's the people I'll always have a chat with someone before we work together to check that it's the right kind of relationship people want to get into, because it's quite intensive. People need to want to make that change. I suppose it's like if someone wants to stop smoking, they need to be in that zone. If the people don't want to make a change, then they're not going to engage very well with the service, if you see what I mean. Yeah. So it's very much looking at what their aims and goals are and how we can work towards improving their health, really, in many different ways.
Yeah, and it sounds like the kind of issues that people come to you with are very varied. I was going to ask you what's the most common, but after that great long list, it's probably there's not one particular thing that kind of stands out. People come to you with all kinds of different things.
All kinds of things, men, women. However, the predominant bulk of people that I'm seeing is perimenopausal and menopausal women in that midlife, really struggling with tiredness, weight gain, low sex drive, lack of motivation, low mood, increased anger, worsening mental health symptoms, perimenopause and OCD and ADHD symptoms are worsening, all sorts of things that can worsen because of hormone changes. And it's kind of coming to a head in that perimenopause phase. So there are a lot of the symptoms that I'm getting to see.
Right. And you've also written a book. We spoke about that last time, but just recap a bit about your book.
Yeah. So Happy Hormones, Happy You. It is a foundational book for people to understand about their hormones and lifestyle, and what people can do in your lifestyle to hack your hormones, and what we can do to optimize our hormones. And yeah, it's really user friendly. It's very limited jargon. It's very much about people being educated and empowering themselves to make change, really, and understand that process of the gut health, liver health, detox, hormones, which ones do what we need, PCOS, what's going on. So yeah, it's aimed at, and it's not just for women, it can be for husbands of women, and for people who just really want to understand, for every man there is a woman in the life. So it's for everyone to read, and it will educate and empower them, kind of get them to, if you're a very firm believer, if you understand what's going on, you can then make change.
Sure. No, I agree. Okay, so if people are listening to this and they've heard you talk and they think, oh, okay, I'd like to maybe talk a little bit more to Dr. Milli, or I'd like to read her book, how can they do that? Where can they get hold of you, and also where they can get just more information in general?
Yeah, so my website, which is drmilli.co.uk. So people can book appointments to come and see me. There'll be a 10-minute chat before people want to come and see me, just to check that we're the right fit to work together. And then there's more information. I do regular blogs, from nutrition topics to exercise. So have a look on there if people wanting more information. Obviously on Instagram, I'm at DRMILLI at Dr. Milli. And then my book, Happy Hormones, Happy You, if you just Google that, it'll come up on Amazon and people can buy the book online.
Okay. And presumably on the NHS website, there's plenty of hormone useful information as well.
Yeah, so there is information on the NHS website. On my website, I've got a list of recommended reading and resources as well for people to be referred to different societies that have got a lot of information as well. So yeah, there's a lot of wealth of information on there.
Good. Very good. All right, look, Dr. Milli, thank you very much indeed for chatting. I think this is potentially very helpful, very useful for a lot of people. So many thanks.
Thank you very much. Thanks for having me, Mike. Take care.
Thank you very much to my guest, Dr. Milli, talking all about hormones. Thank you to you guys for voting in the UK Health Radio Awards. Please remember to check out the back app chair on my website, which is relaxbackuk.com. And thank you to you very much for listening, and have a healthy week. Until next week.
Thanks for listening to the Relax Back UK show. Join me, Mike Dilk, again next week for more fascinating interviews and chat. If you're listening to the podcast version, please subscribe, like, and share it with your family and friends. And have a healthy week. Until next week.